Assalamualaikum and good morning, everyone. Today, I would like to talk about medical emergency assignment. So, my name is Alif Haikal bin Izwisham, metric number DPC 122210019. First of all, we read the assignment task, which is you have noticed that your friend has bleeding on her face and finger after doing some experiments in laboratory. In your role as a first aider, explain how the management should act. First of all, we need to apply general management, which is danger, response, shout for help, airway, breathing, circulation, disability, and exposure. By applying the general management, we can avoid more serious things from happening. Danger. Stay away from danger. Move the victim to a safe area. Respond. You must alert. Eyes are open and cautious. Verbal. Call the victim names. Pain. Unresponsive. Shout for help. Ask help from other person who are around that area. Call emergency service. Example 999. Airway. Check the victim airway. Place the finger in front of the nostril. Breathing. Look at the victim chest. Circulation. Presence of pulse. Disability. Access. Range of movement. And lastly, exposure. Access from head to toe to check for hidden injuries. How to stop the bleeding? First, putting pressure on the area with a tissue or gauze pad. If doesn't have that type of things, we can use clean cloth. The bleeding should stop after a few minutes. If the blood soaks through the gauze or cloth, add more gauze or other cloth and apply more pressure. If the person have face injury, which is at his face has a wound that have blood, lay them down and keep it still. Do not move the patient head too much. Why? Because to prevent further bleeding. Causes that might be happen if we move the patient head too much. It may dislodge something or put pressure on a nerve of other underlying tissues. Make sure before apply the gauze, tissue or cloth, run clean water on the bleeding area so that it is clean from foreign matter. Why we need to apply pressure on the bleeding area? Because number one, it will speed up to bleeding to stop. When lack of blood, our body will become weak. It also helps the bleeding not to come out away, and we need to sustain the pressure as long as we can. Either, if we are tired when sustain that pressure, we can secure it with an ace wrap or a belt or anything that's going to hold that pressure, such as when we tie a belt or ace wrap, we can relax our sustained pressure before. Instruct the victims not to move in order to facilitate to treatment. When bleeding on the face, remove all objects or glass that are in the wound area. If we do not remove all the object or glass at the wound area, it will become more bad wound. Run a clean water on the wound area. After run a clean water, make sure the skin is dry before we apply a hand supplies to cover the wound area. Make sure that hand supplies cover all the wound area so that it is not exposed. Hand supplies is the perfect solution for minor cuts and wounds that plague everyday life. When we bleeding on the finger, how to tell if a cut needs medical attention? It's deep enough that you can see fat, muscle or bone. The wound has jagged edges or edges that are far apart. The wound is long or blood is gushing or spurting from it. For its steps, stop bleeding by putting pressure on the area with a tissue, gauze pad, or clean cloth. The bleeding should stop after a few minutes. If the blood soaks through the gauze or cloth, add more gauze or another cloth and apply more pressure. That's all from me, Alif Haikal bin Izru Hisham. Before end this presentation, I have quote of the day. Life comes from the earth and life returns to the earth. Thank you so much. These are my reference.